Hello and welcome. You're watching FYI. I'm Sonal, Mehrotra, Kapoor. Now, PCOD, PCOS, we all know about it, heard about it, but there are so many myths wrapped around these two extremely common problems that women in the country are facing. In fact, it's not just a subcontinent problem. Globally, more and more women are being diagnosed of PCOD and PCOS. The old-timers, gynacs, etc., who have seen this trend, sort of as they call evolve, say that earlier women had it, just did not know. There wasn't enough diagnosis being done, but now there is awareness, and that's the reason why more and more women are getting it. But before getting into what exactly is PCOD, how is it different from PCOS, how do you fight it? Are pills the only way, or can you make some changes in your diet and your lifestyle that can reverse this as well? All of that is what we will tell you on the program. First up, as always, our explainer. Alright, so let's get to know PCOD and PCOS a little more, and we'll start with symptoms first, right? Now, what exactly is PCOD? What exactly is PCOS? So, PCOS is a disorder of the endocrine system. PCOD, on the other hand, is an imbalance of hormones in your body. The causative factors, etc., PCOS can be caused because of a metabolic syndrome, more serious than PCOD. PCOD is said to be a lifestyle condition and can be managed. That's why through lifestyle and dietary changes as well. In terms of diagnosis, well, multiple layers over there, but PCOS, generally you need an ultrasound image that shows large ovaries than normal. PCOD, or ovaries will be filled with follicles that do not appear much larger. Causes, and this is important to know, PCOS can be due to genetic, hereditary conditions, hormonal imbalance, insulin resistance as well. There is a deep connection between this, and then there is a thyroid that comes into play. This is what we'll discuss on the program as well. But just to give you a glimpse over there, PCOD, on the other hand, is a result of hormonal imbalance, emotional stress, genetics, obesity, bad dietary habits, and you will not believe how bad they are even when you considered very fit in your life. And occurrences, let's look at those next. In PCOS has lower number of patients. PCOD is in fact more common than one can really comprehend. Almost 1/3 of women around the globe. That's how huge PCOD is. 1/3 of women across the globe suffer from this. Let's look at signs and symptoms next. In PCOS, you will have hair loss, baldness, mood swings, headache, weight gain, infertility. PCOD, very similar, but not quite, because it will have irregular periods, you will have weight gain, you will have acne, you will have excess hair growth on your face and body, you will have dark pigmentation, and you can have infertility issues, but nothing that is not reversible. If you look at infertility, specifically between the two, PCOS, women who don't ovulate regularly, they are considered to have PCOS. PCOD, you regularly don't understand as well. In fact, another pointer there to remember is that many eggs don't realize, as many eggs do not fertilize as well. So it's the quality there over that is being talked about. And PCOD, it does not lead to infertility in all women, and shouldn't be considered an obstacle towards pregnancy as well. 80% of the cases in PCOD, women can possibly conceive with a little aid and experience a smooth pregnancy as well. Now, but how many women, having understood the difference over there, just to give you a glimpse of how many women suffer from this? Well, PCOS affects 3% to 20% women of the reproductive age, 3.8 in India this is, 3.8% women below the age of 19 have PCOS, 16.81% women between the age of 20 to 29, 11.58% women between 30 to 44 age bracket as well. And if you look at PCOS globally, well, almost the same figure over there. So it's not a subcontinent issue is what we need to understand over here. Well, what exactly are the diagnoses, how to fight it, management, etc. All of that we will take it up with our panel. Let me introduce them next. We've got Dr. Deepti Rana with us, Senior Consultant, a dermatologist, at the laser and aesthetic physician. She practices at Max Healthcare, has her own clinic as well. Dr. Neeta Kant is a chairman HOD Gynac at the Asian Institute of Medical Science. Thank you so much for your time, ma'am. And we also have Dr. Shikha Sharma, nutritionist and wellness expert. I'm very happy to actually have this three bouquet of people. We've got a dermat, we've got a gynac and a nutritionist, just to get a wholesome picture over here. Right, let me first begin with Dr. Neeta Kant. Dr. Neeta Kant, I've given a very basic idea of what is PCOD, what is PCOS, but it is such a huge issue. I've met two kind of women. One who think, oh, what if I have PCOD, and others who can't stop stressing about it. Right? So as a experienced gynac who's seeing more and more cases these days, especially in the age bracket that we talked about in fertile women, in women in the age group of 20 to 40 basically, what is the outlook that one needs to have towards PCOD and PCOS? Can we just start by understanding that?
Actually, first of all, thank you for inviting me. We have to look at the age group of the lady who's coming to us. It may be an adolescent. Her problems would be different. She'll be more bothered about her acne and her hair, which are growing in the abnormal places, and she may be having hair loss, the male kind of baldness, and she would not be really bothered about her periods being irregular or she having any such problems. Then there's the reproductive age group. Once the woman is married, she's more bothered about her fertility, her conceiving, her regularity of periods. And then later on in the pre-menopausal age group, it's the hormonal imbalances and weight issues, and of course the hair and the baldness and hair loss, and also she may be having certain things like endometrial hyperplasia, something akin to pre-malignant problems, and of course the metabolic X syndrome. So it depends on what age group she comes to us, what is the main stress of her problem, and depending on that, we tackle as per the patient's problems.
Right, but it can be tackled. So all those women who are
Yes.
getting extremely stressed about it, thinking, oh my God, how is this going to happen? I had plans, I had an age at which I want to be a mother and stuff like that. And nothing wrong in it, frankly. They need to stop stressing. That's one, because that's a vicious cycle. I'll request my producers to put out the graphic also that includes management and medical treatment. It actually talks about everything that is happening to your body because you have PCOD and PCOS. So mood swings, weight gain, not being able to lose weight, all of this is because there is an imbalance in your body, and there is nothing wrong with you. It can easily be fixed only if you have that awareness. Talking about that awareness, let me go to Dr. Deepti Rana. Dr. Rana, a lot of people who don't know that they have PCOD or PCOS, come to you first, come to a dermat and start complaining about problems that are very superficial. How important it is, and I've seen this in several cases, women getting bothered and getting laser treatments done without understanding that it's only going to come back till the time you get to the root of the matter.
Yeah, hi. So thank you for inviting me first. So yes, I have a lot of people walk into my clinic, especially girls of about very young age also, and even elderly above 25, 30, simply just having little acne, facial hair, and they just don't really know that what is going on underneath and what's not. So they just, because they have facial hair, so they undergo lasers and multiple lasers, and still there's no change in that hair pattern, or the hair is not reduced. So then is where we really need to assess what all this is happening. And most common thing, at an age when you're still getting acne, when you're not supposed to get, not a teenage and still getting acne, specifically jawline acne, which is mostly hormonal acne. And then they have an issue that they have a lot of weight. I mean, they put on a lot of weight, and they're doing everything possible but unable to lose weight despite of all kinds of exercises and everything. That's why they don't know that there is something going on inside, which could be an insulin resistance or PCOD, or could be anything else like a thyroid or something. That's when we come into play, that we need to investigate further by doing some blood tests and ultrasound and everything. And then maybe take it from there, that we just need to treat the acne, or we first need to treat the underlying cause and then treat the acne, hair, pigmentation, or mood swings or irritability and all that that's causing because of the acne, because of the PCOD.
Right. So it's important to do a thorough
important part
examination and understand why it's happening first.
Yes.
I think
Yes.
that's really
Yes.
key.
Yes.
But having done that examination, and we talked about in our explainer as well, the test that you can get done. And of course, this is just FYI. Remember, you need to consult your own doctor and they will tell you what is the right way to go ahead with it. One size doesn't fit all, especially in medicine. Having understood that, so one of the key things to fight PCOD and PCOS is putting women on contraceptive pills, which has its own side effects, etc. But there is a huge debate going on about how do you need medicines, or is this something that can be altered without medicines as well by making some dietary changes and getting a grip on your life in terms of changes that you can do in your exercise, in your diet, in your sleeping and eating pattern. Taking a cue from that, let me have Dr. Sharma really lay some light on that. Dr. Sharma, huge interest on how women want to reverse it without medicines. I first want to understand very candidly from you, is it possible to reverse it without medicines? Have you seen such cases? And if yes, what works?
See, fundamentally, there are three things which are very important. The first thing is that many years back, heart disease was not considered reversible. And over time, it was seen that heart diseases are actually reversible. So with a lot of lifestyle disorders, it is possible to reverse the disorder, but there are certain riders to it. Now, the first rider is that you have to diligently follow the nutrition and the lifestyle changes. It's not something which is done as a 3-month protocol or a 2-month protocol, because eventually, if you go back to your old habits, you're fundamentally bringing the disease back. So, for example, let's look at hypertension. Now, when somebody has hypertension, it is coming from a variety of disorders, a variety of situations where stress is one of the fundamental situations, along with the kind of a diet and the sleep pattern and other things. Now, for most people, they look at lifestyle as a quick fix, and lifestyle is not a quick fix. There is nothing like a quick fix for a lifestyle. You have to make a variety of changes. So having that rider out, yes, if somebody is willing to change their lifestyle, if somebody is willing to make those fundamental changes, all lifestyle disorders are reversible. Because that's the definition of a lifestyle disorder, that you could reverse. Which doesn't mean that you reverse it for a point of time and then go back to your old lifestyle thinking that, oh, I'm now okay, so therefore I can. Reverse means you change your lifestyle. So that is, now having said that, when we are saying it's a lifestyle disorder, there are 3 components to it. One is a genetic component, which means that if in your parent or in your whole genetic tree, there is a pattern of you being resistant to insulin, or there is this pattern which is coming. Number one. Now, when we talk about genetics, I think I want to touch upon 2 very fundamental things. That there is an emerging field of epigenetics, which means beyond genetics, which means that that your DNA is not hardwired, which means your DNA could be a code, but how that code talks to the body,
how fascinating.
How it expresses itself is in your hands.
Right.
So you might code, but your body may choose to read the bad version of the code, which is the disease. Or you may through your own lifestyle changes, watch that portion of a bad code and actually express a better positive. So this is the beauty of epigenetics, which is an emerging science. What is coming out is that our nutrition, our sleep pattern, and how we manage stress could have a very fundamental or profound impact on everything, starting from polycystic ovarian syndrome to cancers. So that is a whole range of ways that would have correct your nutrition, your exercise, your stress, and your sleep pattern. Sleep is very important. So now, what typically happens when you get patients of polycystic ovarian syndrome? The first place where they land up is actually a beauty parlor, where they say, "Oh, I have some extra facial hair. I want to get." The second place they go to is somewhere where they want to knock off few kgs because they think, oh, the weight is not connected to their disorder. And a gynecologist saying that I'm not getting my period. They different people, which is This will give them.
I'm just going to fix that line with you, Dr. Shikha. I'm losing your signals in the middle. So let me just fix that line. But very interesting concept that you've talked about how your body is not reading the code, right? There's no problem with the code per se. That's really fascinating. Let me go back to Dr. Anita Kant then. Dr. Kant, there are always going to be women who are not in control of their time. And this is coming from a personal space, of course. There are jobs which are high stress jobs. Are these women for them, when they get diagnosed, we spoke about two kinds of women, right? One who stress about it and others who simply do not give enough importance to it. Can we address a second type now on what exactly is the treatment for women like that who are going through a period where there will be long work hours and, are in a job which requires more time and there is no functionality of sleep and you can't really get into a routine? What do those women do?
You have to take out some time for yourself. Whatever time it is, day or night, does not matter. Preferably, you should try and sleep during the night hours because melatonin, which is secreted during night times while you sleep, really helps you a lot in so many disorders. Second thing, leaving stress behind. Third thing is whatever little time you have to have as me time. And that during 24 hours, every woman can manage if she wants to. And fit in yourself in that time, give it to you, take care of yourself, work out, change your lifestyle, give up on smoking, give up on alcohol as much as possible, try to reduce your fat, and for that, yes, we have a dietitian on our panel and she's really good at it. She'll let you know exactly what all to give up. Problems happen when what she was talking about epigenetic, it's like we have a pair of twins. They are same genes twins, but they are brought up in two different environments by two different couples. They will turn out to be slightly different or maybe majorly different from each other. So same way with the same genes, you are not supposed to be having all the bad points of PCOD or PCOS if you control your environment. Why do we have to eat from out? All those dietary things which Dr. Shikha will be telling us, which worsen the PCOD. The fast food, the trans fats that we use, and not sleeping at night.
So are there good substitutes for this? That is something I want to focus on. But I'm going to do that on the other side of this very quick break. We're discussing PCOD and PCOS and we're taking a non-hyped up outlook. We're trying to discuss and trying to come to some conclusions and solutions here that are actually possible for you to adapt. So stay tuned. You're watching FYI. Welcome back. We are discussing PCOD and PCOS. Let me go back to Dr. Deepti Rana at this point. Dr. Rana, then, one of the things that has bothered people about PCOD and the treatment is contraceptive pills. Now, studies tell us that contraceptive pills, if taken over a long duration of time, can actually do more harm than good. For young girls who've been diagnosed with PCOD, PCOS, what's your outlook?
So see, there are different modalities of treatment and there are different steps of treating PCOD. So initially, as we get a patient with confirmed PCOD with an ultrasound, blood tests and everything, first and foremost, depending on what all symptoms they have, so suppose they have acne, facial hair, oily skin, pigmentation of the body folds, weight issues, so everything in falling into the PCOD syndrome, then yes, looking at the age, we do first foremost thing is lifestyle modification. That is, as Dr. Anita rightly said, exercise and a good dietary modification. That is the most important thing. Then if we see that the volumes of the ovaries, the size of the follicles of the ovaries are quite high, above 10, then yes, we do need to give OCPs, that is the birth control pills. But we have to do that cyclically. That means we have to do it every 3 to 6 months, then do an ultrasound to see the level, the volume of the ovaries, the size of the follicles, also the hormonal levels where they've reached, and then maybe give it a little extra for a month or two. Maybe so that because there is no cure for PCOD.
Right.
Yes.
You're saying constant monitoring is important.
PCOD.
Right.
Yes.
I just want to...
is where we...
Sorry, go ahead.
Yes. No, so that's once we've done that, along with that, we have to continue with the diet modification and exercise that will go on for as long as they remember to do that. That is one thing which goes on
But how is that possible? How does one do it? What is the approach? Let me give the last word to Dr. Shikha Sharma at this point. Then, Dr. Sharma, a lot of people talk about diet, and the only count people do in their diet these days is the calorie count. I keep talking about this, and isn't the nutrition count something that we should be doing, especially as women, especially we are so dynamic in the way our hormones respond? How is it that we're losing sort of count on this, and what is the best way to actually do this in a country where food is not labeled properly, in a country where we see, when we go to pick up a store, there is no label telling me how many nutrients it has. It at max will give me a vague idea about the calories or sugar, if that is bankable at all. So how does a modern age woman who's working, managing the house, trying to be Durga all the time, how does one do it?
That's a fantastic question and a fantastic observation. And actually, this is a separate discussion. But the calorie count is actually wrong, and the fundamental of the calories is not based on human biology or metabolism. It is based on physics and combustion, which is burning things. So the whole foundation of the calorie principle is wrong. But coming to your larger question, you're right. It is the nutrient count what we need, and the nutrient count is based on 4-5 things. The first thing is how much of the green vegetables and fruits which are antioxidant rich is one consuming in the diet plan, in the daily plan, because all your regeneration, all your cellular repair is dependent on these antioxidants. Number 2, it's very important that how low glycemic index food can you be having. Now, when I talk about glycemic index, whether it's white rice, whether it's starchy potato, whether it's corn tortillas, whether it's chips, whether it's atta, all these are very high glycemic. That means they go into the body and disrupt your insulin. So the fundamental of good eating is low glycemic index, which is your dalia, which is your whole oats, which is jowar, ragi, bajra. Now, this is fundamental of management. Third thing which is very, very important is that how much of artificial chemicals are we consuming? Now, we don't realize, but these chemicals mimic hormones inside our body, and they disrupt the whole hormonal cycle again, which means all those artificial colors, artificial flavors, artificial stabilizers, they don't realize they might be called edible, but if you're having in too many quantities, they can actually, because everything in our body happens through a receptor system. Something comes, binds to a receptor, and then this receptor will take it inside.
I think, Dr. Shikha, you're right. We should do a separate episode on how to eat your way out of PCOD and PCOS, and only discuss what is the best way to go forward with this, because that's a longer discussion. I'm completely out of time. Thank you, ladies, for joining us with your perspective. We promise to come back and look at this issue only from a food perspective. That's it for now. Bye-bye.